having a flare, typically it's cramping, and a lot of it's like an urgency, but a painful urgency. So it's not just a normal feeling that you're used to when you have to go to the bathroom. It actually just kind of hurts throughout your whole abdomen.
I can get bloated sometimes. I can feel like there is something heavy, like a rock, sitting in my abdomen. Sometimes it hurts to go to the bathroom.
It's usually abdominal and pelvic pain. It usually comes with a flare up. So if I'm on medication that's keeping my Crohn's in check, I generally tend to have less pain. But that said, given all the surgeries that I've had, and sort of all the flare ups that I've had over the years, I have a lot of scar tissue.
Back when I was first diagnosed, about 11 years ago, arthritis was a big one. My joints would crack. Were not very flexible. It was tough, and I still experience that every so often. And I definitely experience a lot of extraintestinal inflammation in my eyes. My eyes are very consistently red.
I've accumulated so many different diagnoses like arthritis, like I have a herniated disc right now in my neck.
Pain is a very individual feeling. There are some patients who have lots of inflammation that we can see during their colonoscopy, and they actually don't report that they have a lot of pain at all. And then others who may not even have very much inflammation on their colonoscopy or on another test, and they can experience pain that is quite intense for them. So I think every patient experiences this a little bit differently. In Crohn's disease, you have inflammation that goes across the entire wall of the intestines, and it can affect any portion of the intestines, all the way from the mouth to the anus. When the inflammation is causes very, very deep ulcers, that can certainly be very painful for patients. As inflammation goes through the entire wall of the bowel, sometimes this inflammation can actually bore a hole in the wall of the bowel that attaches to different organs, or even a hole that goes out to the anal area. And when that happens, it causes something called a fistula. And fistulas also can be quite painful because they often become infected, and that can cause swelling and irritation of the tissues around the bowel.
The other type of pain is joint pain, which can be associated with Crohn's or UC. Some patients have other manifestations of inflammatory bowel disease outside of their GI tract, in addition to the joints, where the joints are more common. Some patients can experience eye pain, painful skin rashes, or even perianal pain due to an abscess.
Even though many patients experience pain, it's not normal for people to live a life of pain. And so there are many things that we can do to address people's pain. The first thing we need to figure out when a patient is having pain is why they're having pain, because we really want to make sure that our treatment is addressing the problem. So if they're having pain because their inflammatory bowel disease is active, which I would say is probably the majority of patients, it's really important for us to change their medications so that we are healing up the tissue.
I talk about pain. I'm assuming that the person has identified with their doctor, or in the process of identifying with their doctor, a treatment plan, if it's from inflammation or the like. So I'm looking at it more from a quality of life angle. It's obviously the goal of treatment, of pain management, is to have as little pain as possible. But there may be stretches of time where pain is part of your day.
In inflammatory bowel disease, I find particularly helpful for that cramping type pain and Crohn's and UC to use an antispasmodic medication as needed. Those medications are designed to relax the smooth muscle, which is the intestinal muscle, and that can help in the short term. We try as much as possible to avoid narcotics or their use long term, really at any cost, because of all the negative side effects.
Sometimes we try to treat the anxiety and depression piece of this with antidepressants. We also often use very low doses of antidepressants in order to basically tune down the pain response that's inappropriate. And those can be tools that are quite helpful.
How I would approach pain management with a patient is looking at how well their pain is being controlled, whether through medication or the like. So get an idea of where they are, and then, understanding what they're doing to cope with it, and then looking for opportunities to make small changes where I can. Everybody says this all the time, but something as simple as diaphragmatic breathing can help reduce pain in the body.
Hypnotherapy.
Keeping a pain journal.
Some patients have reported benefit from exercise or yoga.
Physical therapy that can be quite helpful for addressing things in some patients.
Pacing, where a lot of times when people have pain, they'll rest and then they'll have a day that they're feeling better, and then they overdo it. And then they I gotta get everything done today because I feel better, and then they feel horrible.
We don't really have evidence that cannabis helps reduce inflammation in inflammatory bowel disease, but there are certainly some patients who say that they get benefit in terms of pain. I think it's important to understand your local laws and to talk to your doctor about whether this might be a right choice for you.
Constant stress of having pain leads to more pain in different ways, and I think that is the most upsetting part about all this stuff is, the mental aspect, right?
I'm somebody that doesn't like to take a lot of medication, and actually things like meditation and relaxing help, because I've realized that a lot of my pain actually comes from the tension of knowing I'm having a flare and realizing that my body is going through some stress. So just relaxing my mind actually takes a huge amount of relief from my body.
I don't really like to take too many painkillers, like over the counter or orally speaking. There's addictive qualities to some of the opioids and narcotics out there, and I've definitely struggled with that in the past.
Maybe just like a walk around the block, maybe meeting up with a friend and kicking a soccer ball, just something to keep me active, keep me moving, to not only have me not focus on the fact that I'm in pain, but also see if, that exercise, that shifting around might help a little bit.
So my fatigue is the worst symptom of IBD for me. I've said if I could get rid of one symptom and keep all the rest, that's the one I would get rid of.
Even being in remission, I have significant fatigue every single day, and it's one of those things that if it comes with pain, forget about it. The day is over. I'm in bed all day and I need to take care of myself.
The other stuff might seem worse to other people when you're looking at it from the outside, but the fatigue it takes over my whole life.
I played soccer and I swam competitively and I loved it. And when I got really sick, I lost about a third of my body weight, and I was no longer really able to keep up with everybody. It was tough. I was a freshman in high school weighing like 85 pounds, and I was swimming against people that were a foot taller than me.
It's almost like there's weights inside of your entire body, and when you try to move, it's like, oh, this is heavy, and then after like 3 steps, you're like, this is too heavy. I can't take another step.
A lot of times active inflammatory bowel disease can be associated with anemia or low blood counts that can lead to fatigue and poor exercise tolerance.
It's really important to get your labs checked if you're feeling tired to make sure that the blood counts aren't low, because that can be treated with supplementing these iron, B12, and other vitamins. And that can lead to restoration of the blood counts and making people feel better.
If there's very active symptoms at night and there's poor sleep, that can lead to fatigue. So there's a lot of reasons, and fatigue is a tough one because it can be caused by many, many, many things.
It doesn't have to be clinical depression, to cause fatigue. Even low mood, without reaching that really severe level will cause fatigue to happen. So getting into how is the person coping with fatigue? What are they doing? How are their sleep habits? I do a lot of work on what's called sleep hygiene.
There are also some medications that can sometimes cause patients to feel fatigued. And again, this is not one medication that causes this for everybody. But there are certain medicines that can lead to fatigue. So it's important to review your medications with your doctor. Just like with pain, we want to make sure that we're treating the right thing, because these different aspects of the disease that can cause fatigue are treated in different ways. So if it's inflammation, we want to make sure that the patient is getting treated on the right medication or the right pathway to getting their Crohn's disease or ulcerative colitis under better control. If they have low blood counts or a vitamin deficiency, we want to correct that. If they're having a problem with a medication, we want to make sure that we change around their medications to make it easier for the patient, so that they're not feeling so drained by that medication.
And looking at the particular person's sleep, their depression, anxiety, screening for those things, helping with the stress level that is associated with inflammatory bowel disease, and on multiple levels, this condition can be accompanied with a lot of stress.
Treating fatigue from a psychological standpoint is difficult, but usually what I do is I do a real comprehensive sleep hygiene assessment. I look at, are people taking naps during the day? Because sometimes naps, which can be wonderful, result in difficulty sleeping later. Are people drinking too much caffeine? Are they moving? Actually being sedentary makes you more fatigued. So light exercise is another treatment in IBD that does have some evidence behind it. Yoga, stretching, these types of gentle movements actually get people feeling a little bit more invigorated without pushing them too hard, as like going for a 5-mile run or something like that.
Like, got blood work done to see if I was deficient in anything, and it would always come back like on the borderline for B12 and for vitamin D. So I didn't have this immediate need for it, but I decided to give it a try and started getting the B12 injections every week at first, and then you can start to space it out a bit. And it made a world of difference for me.
I try to drink a ton of water all the time, and I think it really helps with fatigue. I think it really helps with pain. I think that hydration is just so key in every capacity of life.
One of the things that I did early on that my mom made sure that I did was, when I was going into surgery, she found me a therapist. And she also made sure that I attended the local support groups in New York City, where my hospital was. Whether it was inflammatory bowel support groups or ostomy support groups, just to make sure that, look, Tina's emotional needs are being met. I encourage every patient to educate themselves, to learn throughout this journey, because it can only help you, it can only benefit you.
I just really want to encourage patients to be open with their doctors about what they're experiencing, and to know that their doctor is on their team, is on their side.
Whether it's through the foundation, through a local therapist, or if your care team happens to have psychologists on the team, ask for that help before maybe it even feels like you truly need it.
We're here to help, even with symptoms that are sometimes difficult for us to treat. That it's really important and helpful to have an open line of communication.
I also really have appreciated meeting other people through Crohn's and Colitis Foundation who have IBD and be able to develop some sort of support network there. Those connections have been so meaningful to me.
I know everybody's style of managing disease is different. I know a lot of us want to sort of avoid dealing with the medication decisions, or having this be a shared decision between the doctor and the patient and their families. But really, it's very important to understand, what this disease is, what the treatment options are, and how we can optimize and really maximize our quality of health.
And it's tough, but you get there. And I think that one of the things that I'm experiencing right now is that, I've 12 years of this. I've been feeling pretty good for the last few, and now I'm having a pretty decent flare-up right now. And it's kind of weird. It's like, oh, I've been doing this for 12 years. Like, I felt good for a while. Why is this happening right now? But I remember, there was a sunny day that came after the first time, and then there were a few sunny days, and then there were only sunny days. So it'll get there again, it will. There will be sunny days.